Yeah, a couple thousand to do that.
3 people, a little under 30,000. You've got the answer for her.
That would put you at about 145% of the federal poverty level, which actually would put you above the limit for the Medicaid expansion here in Utah, which means that you would qualify for the new insurance marketplaces, which are coming online on January 1st, but you can start signing up on October 1st. And I just crunched a couple numbers before I came here, and you would actually get a tax subsidy that would cover 89% or thereabouts of your health premiums for this new insurance. And it would be good insurance. It would be insurance that would cover care for yourself, your husband, your child, as well as maternity care for if you wanted to expand your family. That's the kind of insurance that's coming. The one thing I wanted to add, though, was that there's also, right now, people can, as Judy mentioned, go to healthcare.gov. The website has a pre-enrollment checklist that you can look at. You can get information about what you'll need when you start signing up for coverage on October 1st. There's also a toll-free number you can call. Let's say you don't have the internet at home. You can go to 1-800-318-2596.
Say it again.
1-800-318-2596. That toll-free number is operational right now. I called it just before this meeting, and a very nice person answered the phone.
Jason, I'll have you do that introduction if you would.
Sure. Well, of course, the title of today's event is Are You Ready for Obamacare? But I don't think healthcare.gov, the website, was ready for Obamacare or prime time, because that's been the frustrating aspect of the past week, is that the site's been slow, it's been glitchy, they're trying to fix it, but a lot of people are still not getting through. And all I can say is that it will get fixed and it will be ready, and there is a long enrollment window going until the spring that you can sign up for this new insurance.
Jason.
Well, this is how I answer questions like that. Is I have a nanny, she's 62 years old, she watches my 2-year-old son. She had a pre-existing condition that meant that when she went out to buy insurance, it was going to cost her $1,000 a month. So she wasn't able to afford that. And her pre-existing condition was that, well, I won't get into it. But when we ran the numbers for her, her insurance is going to cost $230 a month under the Affordable Care Act, $900 to $230. And she's going to be eligible for Medicare in a couple years. And by being insured and being healthy for a couple of years before she gets on Medicare, she's going to be a healthier person for the rest of her life. Not only, I care because she watches my son, but I care about her because I want her to really enjoy her grandchildren and her life. And so being insured means a lot both for her and for many people in her family. And that's what I think about when I think about what the Affordable Care Act does in Utah and in our country.
Okay, another...
Local experts say part of the problem is healthcare.gov, where people go to enroll, just can't handle the traffic.
It's almost like, the shopping after Thanksgiving for Christmas. Everyone was piling through the door, and very few people could get through.
Jason Stevenson is an expert on the Affordable Care Act with Utah Health Policy Project. He says you'll need to be patient when logging on, but says the system is improving.
All the plans are going to be right next to each other. They're all going to have the same type of information about deductibles and co-pays, and you'll be able to make a smart shopping comparison.
Now, a Utah-based advertising campaign is trying to get more of them to realize the dangers of going without medical insurance. 1 in 4 young people under the age of 35 are uninsured in the state of Utah. That leaves them at risk of paying out big if there's a medical need. On top of that, the Affordable Care Act needs healthy young people to enroll to balance out the program and make it work. Mike Anderson shows us how a newly launched local effort is trying to address both of those equations. Mike?
Yeah, Dina, you're likely to see more of these images going across social media starting yesterday, actually. They're comparing some of the risks we take in Utah, like this year. I took this risk today, eating fry sauce, to going without medical insurance, and they feel that many people are taking their chances instead of playing it safe.
Utah is the first stop on a 6-state tour for Kim Gillen, the new HHS director for Region 8. Gillen came with Doyle Forrestal, the executive officer for the region. They met today with healthcare advocates in a meeting at the Capitol that was closed to the media. But Jason Stevenson of Utah Health Policy Project gave a debrief.
I think we learned that Utah is an important state in the rollout of the Affordable Care Act. They're reminding us that there are 3 million people in Utah. There's hundreds of thousands of people who could benefit from the new insurance options available on healthcare.gov. And they wanted to thank the advocates and the people working on this issue for the work they're doing and give them a pep talk for these last 8 weeks of the open enrollment period.
Jason Stevenson with Utah Health Policy Project says that's thanks to a major rush the last few weeks of 2013.
We had 90% of our 2013 enrollment sign up in a 3-week period in December.
The majority of Utahns chose a more expensive plan on the marketplace, though. 52% went with the silver plan, 29% with gold.
People aren't going for the cheapest plans available. They're going for the plans that actually provide good coverage, cost a little bit more, but are going to help them out whenever they go to the hospital or see a doctor.
That's why UHPP has kicked off the What's More Risky campaign, specifically targeting younger Utahns.
Health insurance for young people is really financial insurance. It's insurance that protects you from that $20,000, $30,000 hospital bill that can come out of nowhere. An emergency appendectomy, something goes wrong when you're driving your car, or even if you're out enjoying Utah's mountains and you're sledding or snowboarding.
You're tuned into Newsday from the BBC World Service. Alan Kasuji and Tom Hagler with you. And the Obamacare deadline passed about 13 minutes ago, after which Americans can no longer sign up for the health insurance for this year under the Affordable Health Care Act. Let's speak to Jason Stevenson, Education and Communications Director for an NGO, the Utah Health Policy Project. Jason, thank you for making time to speak to us. 7 million people registered. That's more than was expected. A good number?
Yes, I think that is a good number, considering how slow things started last fall when the website really wasn't working at all. We've made a lot of headway, especially within the last 3 months.
Now, for purposes of those who do not understand Obamacare in broad strokes or briefly, could you just explain what it means for those 7 million people that have registered?
Sure. Well, the first thing is that it's not a national healthcare system like you might have in the UK or in other countries around the world. Obamacare really preserves America's private health insurance system. The people signing up for Obamacare aren't signing up for a national healthcare system. They're signing up for individual private healthcare plans that are offered in their state. But the difference is that they're getting subsidies. They're getting help, many of them from the federal government here in the states, to make those plans more affordable. Plus, the plans have been designed to provide more coverage, provide better benefits, things like maternity care, prescription drugs. So for many people, the plans are, for the first time in their lives, both affordable and of higher quality than they've ever had before.
In spite of all the politics surrounding the Affordable Care Act and the bungled rollout of healthcare.gov, enrollment in Utah is one of the highest in the nation. The government goal for signups between last October and April was 57,000 in Utah. 84,000 signed up.
I think the 84,000 folks in Utah who have signed up for this insurance is a ringing endorsement that there is something good here, that people are benefiting.
Jason Stevenson says a lot of people in Utah realized their health insurance needs were in sync with what they could afford, making this one of the top states to sign people up. Numbers from the Utah Health Policy Project show people enrolling for health insurance are younger than most states. Almost half come from areas outside the Salt Lake metro area. And a vast majority, 87%, are getting a subsidy to reduce the cost of their monthly insurance premium.
It's known as the medical loss ratio. It requires insurers to spend at least 80% of premium dollars on medical care for the individual and small group pools, and at least 85% for the large group pool. That would include doctor visits, hospital stays, medication, tests and scans, and other covered services, not marketing and other administrative costs.
What it's really designed to do is make sure when these insurance companies are sitting down and thinking of their budgets and thinking about what their priorities are, that they're remembering that paying for patient health care should be their top priority.
The controversial Affordable Care Act is finishing up its first year, and now it's time for the second open enrollment period.
The door gets unlocked on November 15th, and everybody can come in and sign up for insurance. Those that have been waiting, those that have really not been thinking about it, this is the time to actually go and get enrolled.
Stevenson with Utah Health Policy Project says Utahns can expect to find more options when they log on to healthcare.gov.
We've got about 10 new plans here in Utah that are offered. The same 6 insurance companies are back.
Stevenson says because of the additions, it's a good idea to shop around.
We encourage folks to go to healthcare.gov or seek out a navigator or a broker to just make sure everything is shipshape for the new year.
One thing that's different about the Affordable Care Act's open enrollment this year is that healthcare.gov is up and working, and there are new sections within it that make shopping for a plan even easier. In Utah, advocates are hoping to top what they call an impressive 84,000 people who signed up before April of this year.
I think we have many more Utahns that are able to access insurance, able to, be healthy, able to take care of themselves, get that personal responsibility element.
With us in studio is Jason Stevenson. He's with the Utah Health Policy Project. His official title is Education and Communications Director, but can I just call you Health Insurance Enrollment Elf?
You bet. It is the season after all.
That's how I think of you. I mean, there's a whole team working on this, right? What are the folks at Utah Health Policy Project doing to get ready for the season?
Well, we have a bank of computers set up in our office, and we actually...
The big question most people are probably concerned with is how much is insurance going to cost, let's say, for a typical Utah family?
Well, that's where Utah really does well. We have a very efficient insurance marketplace already, some of the lowest cost care in the country. So we went into health reform kind of with the wind at our backs. And actually that helped us because that meant that we had more insurance companies participating. And sort of like when you get off the highway at a rest stop and you're looking for gas, if there's only one gas station, they can pretty much charge whatever they want. But if there's 4 or 5 gas stations, and they're going to be competing for your business and the prices are going to be lower. Here in Utah, we have a lot of gas stations, or I guess I should say a lot of insurance companies that want to play on the Affordable Care Act. And so they're on healthcare.gov. They're driving down the prices. So a Utah family of 4 making maybe about $40,000 or $50,000 a year, if they were to go on healthcare.gov, they would find a lot of plans. They would find about 100 plans here in Salt Lake County they could choose from. If they chose a silver level plan, their premiums would probably be in the order of, if all 4 of them were getting insurance, about $600 a month. But they would get a subsidy of probably close to $300 or $350 a month. So their insurance would actually be maybe $200, $250 a month to cover that entire family of 4.
Like many of us at some point in life, James Phillips found himself in a bind. He lost his job, his insurance coverage, and became ill. He eventually found a plan that would take him, but for a cost of $700 a month.
I had to make the choice of, because I couldn't afford it with the illness, of whether to feed my son or purchase insurance, so I dropped the insurance.
Phillips is one of more than 80,000 people in our state who signed up on the federal marketplace. He's also part of the 87% of Utahns who qualified for subsidies to lower the cost.
So Utahns who got a subsidy to purchase insurance last year are going to find a very similar subsidy available this year to make their insurance more affordable. The subsidies are calculated based on your family size and your income.